So I agree, I mean, you should stay on the Revlimid. You're getting a very small dose, 10 milligrams of the Revlimid.
But that's the only dose that can be given because of the kidney problem.
Because of the kidney problem, yeah. Now you could get thalidomide, which is okay with the kidney, it's not affected by the kidney problem, but it's more toxic. So your doctor prefers Revlimid. And you're having a very good response to Revlimid. I mean, if something is working, we should keep doing it, right? It's working. What's your creatinine? 1.7, right?
No,
It's not bad. 1.7.
1.6, 7.
Yeah.
Yeah.
That's okay. I mean, it's not very high. So I agree with you. I mean, you should be on Revlimid. Now the question is, should you get stem cell transplant? Did anybody talk to you about autologous stem cell transplant?
They talked, but there was a disagreement among the oncologists themselves for two reasons. One is basically I'm above 65 now.
Yeah.
That's one question.
And that's not.
Second thing was that yes, I had a perforation.
Yeah.
And body has many problems like hypertension, diabetes and all that.
Yeah.
So transplantation they didn't suggest.
Okay.
Body may not tolerate.
Yeah, they were worried about you not tolerating it because you had this problem. Now this problem is solved. You don't have any disease, so you can wait. There is no clear evidence that doing the transplant early is better than doing it later. But once your disease comes back on Revlimid, then you can think about stem cell transplant.
By that time I will be some more aged person.
What's that?
By that time I will gain more age.
Yeah.
I am 65
But the
now.
age-
By that time I may be 67, 68, whatever it is.
Yeah. But if you're feeling good, the age itself should not be a criteria, you know. Up to age 70, you should be okay
For transplantation.
for transplantation.
And what about this thing, perforation?
But it's gone now. It's all resolved. There's no perforation now, right?
Then hypertension, diabetes.
Yeah, I mean, that's not a big deal. Hypertension and diabetes, that's not a big deal. Most people have hypertension and diabetes, you know. I rarely see patients without hypertension and diabetes. That should not affect the rest. Autologous stem cell transplant is easy. The way they do it is they will collect your stem cells, then they give you high-dose chemotherapy to kill all the myeloma, and then they give you back your stem cells. The advantage is after the stem cell transplant, you will not need any treatment for many years, so you'll be off the Revlimid, which is good. The risks of dying from stem cell transplant, despite your age and diabetes, is very low, like something like less than 5% of patients will die from the procedure itself. It's a very safe procedure. Now the question is, should you get it now or should you wait? I mean, since you're doing so well on Revlimid, you can wait. And by the time your disease progresses again, there will be new drugs. So you can get new drugs for, you can always argue that you can get something else. And there are lots of drugs for that you have not used. So I'm not sure that transplant is like the best choice for you. But it's something to consider. The advantage of transplant is that if you get the transplant, then you will not need treatments for many years. And I don't think 65 is old.
Plus, he's keeping very fit. We were so
He's
happy
very
to see
fit,
this.
exactly. He's very fit. So stem cell transplant is an option. But for now, it's up to you. Are you paying for the Revlimid or because it's very expensive?
I was in the central government, what you call is a federal government here. So government pays for that, whatever
Okay,
treatment is.
so that's good. Because it's very expensive drug. It's like $10,000 a month.
No, in India it is not 10,000.
And in India it's different, all right. And I don't know if India they have their own generic. Do they make their own generic or is it the...
Some Natco company is giving, but that is costing about 9,000 rupees for 30 tablets.
That will be about $200.
Oh, that's not... Yeah.
That also we don't have to pay.
Yeah. Yeah. Here it costs like $10,000 a month.
That Revlimid.
Yeah, it's very expensive. Everything is expensive in United States.
No, they are giving me 20 days, 21 days and
Yes.
9 days off.
Then 9 days. Then 9 days off or 7 days off.
9
9
days.
days.
9 days off.
9 days off.
Yeah. I mean, you're having good response. So if it works, don't change it.
How long I can continue on this one?
That's a very good question. you should continue as long as you're having a response to it. You should not stop it, because if you stop it, the disease will come back. Now with Revlimid, there is concerns that can cause second cancers. There are some cases of other cancers because of patients have been on Revlimid for a long time. The risk is small, like 5%. I think at this point, because you're responding to Revlimid, I would not stop it, knowing that there are risks, like with anything you do. And you should stay on it.
So, doctor, this
I had
Yes.
stem cell transplant. How easy or difficult that procedure is? Like, so these days, it is being done in India as well.
Yeah.
in India they told me I would have to be in hospital 13 months.
Yes, that's what we do here. Like 2 weeks, merely, not 1 month. They tell you 1 month. It's not really 1 month. 2 to 3 weeks.
And in India there is another problem. Very few doctors are expert in this art.
What's that?
Very expert in this art, stem cell transplant.
Yeah.
So getting the real expert is. But I think that should not be a big deal. We will be able to find.
I'm sure there will be a very good place in India.
लेकिन
Means
ये अपन
with-
डॉक्टर से ने तैयार हुए थे
Hmm.
जो फिजिशियन है ना उनको फिजिस
I will be coming to other questions.
Yeah, go
But
ahead.
meanwhile, I will show you this thing. This is a doctor Advani.
Mm-hmm.
He is number 1 onco physician of India.
Okay.
He is the best physician considered to be. So I have seen through 3 times.
Uh-huh.
His present findings are like this: general condition good, no bone pain, so BM aspirations normal, complete remission, maintenance dose level. He wanted to do even 5 mg, but since I was coming over to USA and I was stable, I suggested him not to change it because if something happens in between, then I will be
नेफ्रो वाली
stable.
के डॉक्टर से
Yeah, I mean, you know, it's very hard to
वो
change the
कहीं
dose
आपका
since
किडनी
it's
में
working.
कोई ये नहीं
Because
है
it's working for you, and your
ये
kidney
कहीं
is
के
not
बाद
too
पे
bad.
दस्तक
It was
दे रहा है
1.5 here.
Then it was
इंटर
okay,
नहीं
but now it is
किया
1.6.
किडनी आपका
Yeah.
वो बहुत ही टेस्ट कराते थे ना
Free lights
आयरन
and
बैंडिंग
0.6.
करवे छे ये सब
Yeah, but that's normal.
एकर को जे
That's
बड़ा के
normal.
बजा खाना लाइक
So
ठीक से जी
my
बच्चे
question
आदमी
is that my
यहाँ के
point of
करवे
view
के
to
कौन
you,
जरूरत है क्या
when I went to him first time,
अपना शरीर
then he said
भाई हमें तो
the
उम्र तो हो
skin
गई
survey was
आज हम यार
negative,
बना
it
तो
was
फुल
normal,
लाइफ लाइफ माइंड
and
में
bone marrow
Continue
aspirations was only
करवा
12%.
अपना ला मुसीबत
So it was not a strong evidence to conclude it was a
10 साल
myeloma and needed
मुझे
any
खींच
treatment.
देगी हाँ
The first time.
First time.
But you're telling me that you were anemic. You had anemia.
Anemic, you can say that maybe because of kidney problem or something like that.
But it's unusual to have that kind of anemia with creatine 1.5, 1.7. I think because of the anemia, that's a very, I mean, to call it myeloma, you need end organ damage. So you need kidney problem, bone problem, calcium high, or anemia. I
So
think,
three things were not there.
yeah, but you had the anemia.
Only anemia was there. So whatever it is, but he says that the treatment was started only because of the MS.
Of the what?
MS spike.
M-spine.
He says the whole
No, we
treatment.
don't treat M-spine.
He says that the treatment was done because MS spike was found by the doctor there.
Yeah,
And he has started treatment of the myeloma.
yeah.
He says that is not the real issue.
I agree with you. However, I mean, again, it's hard for me to go back, but you had anemia, 9.5. Typically, I would start it if you have anemia. Especially that after you started, your counts improved, right? You're not anemic anymore.
I don't know. Any blood counts are not very high as well. It is between 10 and 11.
Where is your last one?
Last one.
CBC. I think I saw one that was good.
Last
The last
The
one.
latest
10
is
10
good,
point
10 point
10
something.
10 7 शायद
Yeah, last. This is the latest.
Yeah, 10.331. So that's a good number. And your platelets were normal.
Yes. Neutrophils was the normal.
Neutrophils are normal. So this number is a good number. You know, it improved with the treatment. I would not stop the treatment. That's your question. Should we stop the treatment because you don't have
Other problems.
Yeah, I would not stop the treatment. I would continue the treatment.
Now coming back to the questions. Now what is the present status of my disease, myeloma?
Complete remission.
Complete.
You have no plasma cells, no monoclonal protein, and no kappa lambda light chain. You're in complete